Good afternoon and welcome to the Master Secret Series. We're very fortunate today to have with us 4 esteemed emergency medicine academicians. I'll start by introducing them, and then they'll all come up and answer a couple questions for us, and then we'll be opening it up to the group for discussion. So I'll start by introducing Dr. Martin. Dr. Ian Martin is System Chairman of the Department of Emergency Medicine at the Medical College of Wisconsin, where he holds appointments as professor with tenure of emergency medicine and internal medicine. Before this, he served as professor and chairman of the Department of Emergency Medicine at West Virginia University School of Medicine. Dr. Martin earned a Bachelor of Science degree from Duke University. He earned his Doctorate of Medicine degree from Medical College of Pennsylvania, Hahnemann School of Medicine, and his Master of Business Administration degree from the University of North Carolina, Kenan-Flager Business School. Dr. Martin trained in emergency medicine and internal medicine at the University of Maryland Medical Center, where he also served as chief resident. Dr. Martin has devoted his academic career to improving the delivery of emergency care globally through program development, investigative research, and direct clinical care. His research interests include elucidation of optimal models for emergency department-based HIV and hepatitis C testing in acute care disease burden epidemiology in developing countries. Dr. Martin has served as President-elect, Secretary-Treasurer, and as an at-large member of the Society's Board of Directors, and he is the founder and past president of SAEM's Global Emergency Medicine Academy. Dr. Martin is the 2018 recipient of the Marcus L. Martin Leadership Award. Our next panelist is Dr. Andra Blomkalns, who is a national leader and an innovation advocate who believes that the best medical care depends upon clinical practice, innovation, technology development, continuous data-driven improvement, and interdisciplinary collaboration. She currently serves as professor and chair of the Department of Emergency Medicine at Stanford School of Medicine. Prior to going to Stanford in 2018, Dr. Blomkalns earned an MBA degree in innovation and entrepreneurship and served as vice chair for academic affairs and business development at the University of Texas Southwestern Department of Emergency Medicine. Reflecting her dual passions for patient care and innovation, she also served on the Intellectual Property Advisory Committee and was the clinical liaison to the Office for Technology Development. In recognition of her commitment to moving life-changing technologies from the lab to the patient bedside, she serves as a juror for the Medical Design Excellence Awards, the premier national recognition program for the medical technology industry. Next, we have Dr. Cooper Minh, who is Professor of Emergency Medicine and Pediatrics and the Bo Thomas Brofeld Endowed Chair of the Department of Emergency Medicine at UC Davis. He is a pediatric emergency medicine physician and clinical epidemiologist and a leader in emergency medical services for children, particularly in multi-center research. He has published works in all 3 focus areas in high-impact journals, such as the New England Journal of Medicine, JAMA, BMJ, and The Lancet. Dr. Cooper Minh has received more than $30 million in federal grants and contracts as a principal investigator over the past decade. He has published more than 225 peer-reviewed publications. Dr. Cooper Minh is one of the founding investigators and founding chair of the steering committee of the Pediatric Emergency Care Applied Research Network, PECARN. Since its inception in 2001 until late in 2008, and he remains one of the 7 network principal investigators. He recently completed a 4-year term as chair of the executive committee of the PECARN Network, an international consortium of pediatric emergency medicine research networks. And we also have Dr. Hopgood, who is the chair and Raleigh McGrath professor of the Indiana University School of Medicine, Department of Emergency Medicine. Dr. Hopgood received her medical degree from the University of North Carolina, Chapel Hill, and residency training in emergency medicine at UNC Hospitals. A native North Carolinian, Dr. Hopgood joined the Indianapolis University faculty as a tenured professor in 2011. Her roles include Associate Dean for Curriculum and Education Development and Vice Chair of, at UNC School of Medicine. She held a variety of roles, including Associate Dean for Curriculum and Education Development and Vice Chair of Emergency Medicine. She has held many national and international leadership roles, including President of the Society for Academic Emergency Medicine, Chair of the ASEP Board of Directors, Chair of the SAEM Foundation, and Chair of the International Federation for Emergency Medicine Governments Committee. She is the recipient of the Leonard Tao Humanism in Medicine Award, the AMA Women's Physician Council Mentor Recognition Award, the American College of Emergency Physicians Outstanding Contribution to Education Award, and the International Order of the IFEM. Let's give them a warm welcome. So they will come up and present on what they believe is their secret sauce or tips for success in academia. We'll start with Dr. Martin.
How's everybody doing? Good meeting so far?
Great.
Awesome.
Oh, well, thank you. That's very kind of you. I didn't pay him to say that, by the way. So anyway, it is a great honor to be invited to do this. Unfortunately, with board duties last year, I wasn't able to attend this innovation, but I heard it was really great, and I got a chance to listen to them all, the audio files of them. But I was really touched when I was invited to be a part of such an esteemed panel, and almost all of them have been mentors to me across time, so it's a great honor. So in the next 10 minutes or so, I'd like to present to you what I call a secret sauce, lessons for a successful career in academic emergency medicine. And I don't have any conflicts to disclose. So like many animals or insects like moths and businesses and humans even, I think academic careers have phases and go through a life cycle. And I sort of broadly say there are probably three, and this is an oversimplification for sure, but the early career phase, the middle career phase, and the late career phase, or as I more affectionately call them, the buffet phase, the laser phase, and the legacy phase. So the early career or buffet phase, and you'll see why I call it the buffet phase in a bit, are really the immediate years post your training. So it's your years as instructor, many of your years as an assistant professor, and really the focus should be on finding your professional purpose and passion. So in the same way that when you go to a buffet, at least the first plate is all about trying a lot of new things to find what you really like. I think this is an important way to do a couple things. So I think it's a great way for you to find what your academic niche is. And then the other thing is I do think it can be protective against burnout and build resilience. I think when people are connected to a purpose and passion, even outside of patient care, it can certainly build resilience. So the purpose, again, is to explore many different professional interests and to embark on several opportunities to determine exactly what really drives you, what you like more than anything else. Again, going back to the buffet analogy, first plate, sample a lot of things, but the second plate should be only the things that you really enjoy on the first. And I think by embarking on a number of these professional opportunities that are offered to you, it's a great way to start meeting folks who could potentially be mentors along the way. So my residency director told me this, alma two. He says, you got to say yes until you can say no. And you're like, what the hell does that mean? You have to say yes, I think, early in your career to prove you're a team player. But there certainly comes a time where you found that focus and people in your group know you truly are a team player, that you can start saying no without any negative consequences. And also, don't be afraid to stumble into your academic niche. You'd be surprised at the number of folks who are really well respected in the field of emergency medicine. You know them for X, but that wasn't necessarily what they started out doing. And so in the end, I think the early career or the buffet phase is really about laying a foundation for academic promotion and for career success. So the middle career or laser phase. So these are going to be your latter years as assistant professor, probably most of your years as an associate professor. So in contrast to the early, where the point was to sample a lot of different things, it's really now about focusing almost singularly on your identified professional purpose, passion, and niche. So now, as opposed to doing a whole bunch of stuff, you're going to focus on one or more professional activities. You're going to embark only on professional opportunities aligned with your identified purpose, passion, and niche. And now you've deserved and earned the right to say no to everything professionally outside your identified purpose, passion, and niche. I think this is a great opportunity in your career, too, to create synergies and amplification. So what do I mean? So number one, align everything that you're going to do, or try to align almost everything that you do in your professional career so that you're really creating what I call a career theme for yourself. Work in academic teams. So if you are an ultrasound person, work in it, bring all the folks in your department together, and if there are 5 of you, you can have 5 projects where maybe for one project you're the primary driver, but for the other 4 you're kind of along for the ride. And so at the end of the year, instead of having 1 paper, you have 5. And by doing that, I'm certain your academic productivity will increase. You'll see more publications, more invited presentations, and more success with garnering grants. So we talked in the early career phase about if you take on some of these professional opportunities, you're going to meet people who could potentially serve as mentors. And I think this is the time to refine it. Refine it into a board of mentors, a term that one of my faculty recently coined. So I think all of us would love to have that one single person who could really mentor or meet all our needs as a mentor, but the reality is that's kind of a unicorn for most of us. So you're going to need a whole network of folks who can mentor you. And this should be a dynamic group. So the folks that you need on your board in your early career or mid-career shouldn't probably be the folks who are on your board late in your career. So in the end, this middle career, which is actually going to be a lot of your career, is about rapidly adding to the foundation for further academic promotion and career success. All right, so now we're late, or legacy phase. And you'll see in a moment why I call it legacy. So now, you're a fairly accomplished person. It's about figuring out how to create long-term, sustainable impact around your professional purpose, passion, and niche. And I think one of the really important ways that you could do that is through folding folks who are earlier in their career into the good academic works that you're doing. Looking for opportunities to mentor them because they may be bitten by the same bug that you were bitten by. And looking for opportunities to actually bestow pieces of your academic work and helping to further their careers. But what you're also doing is helping yourself propagate and sustain your good works much farther into the future. But I think it's also interesting, and I'm thinking of a faculty member in particular, is this a time to think about a completely new purpose, passion, and niche? That could be interesting. We've talked about mentorship and the importance it plays in each of the first 2 phases, but I think this is an opportunity where you really should focus on looking for opportunities to serve on the board of mentors of others. And by doing so, you're really going to be helping lay the foundation for academic promotion and success, not of yourself, but really of others. So I have one slide, here, and I think this just shows how each of us is cycling through these 3 phases, and that there's amazing opportunity for late career folks to mentor early career folks or middle career folks, but I think there's opportunities really almost at every one of these stages to interact with other colleagues who may be in the same or some other phase of this life cycle. So putting it all together, in early career, it's all about focusing on finding the purpose, passion, and niche, and laying the foundation for academic promotion and career success. And in your middle career, like a laser, now you're going to focus singularly on your identified purpose, passion, and niche. You're also going to rapidly add to the foundation for further academic promotion and career success. And then in the later years, the legacy years, focus on creating long-term sustainable impact around your professional purpose, passion, and niche, which by folding other folks in, I think you'll achieve, and you'll help lay the foundation for their success as well. So thank you for your time, and I'd be happy to take your questions at the end.
Yes, thank you, Dr. Martin, for your comments. I did have one question, if you wouldn't mind answering now. What advice would you give your younger self?
Oh, I'm such a cute young Ian.
That's a good question. You know, I've spoken about this before, and some people find this hard to believe, but like probably if you asked me 12 years ago, would I be a chair? And I'm sure I would have said no. I didn't have the belief that, and Dave, you knew me way back then, our Duke days. You know, I was satisfied to be a bedside teacher for the rest of my career. So I didn't have the belief, but through some good mentorship, some other leadership training, I said, well, why not? And so I wish I had had that belief earlier, because I've become a decent leader, and I think I could have achieved so much more as a leader, or I'd be much farther along in my leadership journey if I had known that much sooner. So, thank you.
Thank you. Dr. Blomkalns?
I'm smiling so broadly because I'm envisioning a toddler Ian wearing a suit and a pocket square and everything. And so anyway, it's just cracking me up. But anything, thank you very much for inviting me to be here. It is truly a great honor to be in front of you, and I hope to provide you with some perspective on the different pathways in academia and how what different things mean to different people. And I think you're going to hear something different from all four of us, and then be able to ask us questions, and hopefully they'll all be just a little bit different. Giving you just a brief history of kind of from residency to where I am now. I decided to go into emergency medicine because I knew I wanted to do research. So I didn't want to necessarily ride on ambulances, or I wasn't a paramedic, and I didn't like the helicopter and all those things. But I wanted to do research, and I figured the acute manifestation of everything came through the emergency department, so I could just kick that decision down the road a little bit and then decide at a later date. So emergency medicine, I went to University of Cincinnati, which to me was the great white north for residency, and intended to head to warmer climes shortly thereafter, but ended up staying there for a really great 17 years. Where I had the great privilege of being a residency director, an associate residency director, and then residency director for the infamous David Gordon over there, who I saw sitting there. So I've known him before you knew him at Duke.
Dave's like the most famous audience member.
I know, he's like awesome. He's great. And I'm going to give you a list of things, and I think maybe this is just a little bit different. I think a lot of folks in academia say you've got to pick your thing and go with it. And I feel like that's a little bit of a travesty in that, what if you choose the wrong thing? And I felt like maybe perhaps it's my limited attention span or otherwise, but I ended up choosing several different things. So I was a residency director for several years, and then moved to a clinical research career in acute coronary syndromes with my mentor, Brian Gibler, and then went completely topsy-turvy to a basic science research career. And I'm convinced that if you apply to the NIH a certain number of times, eventually they take pity on you and actually give you the grant. And I love my lab. Had a wonderful lab with wonderful teammates, many of which were students who are now actually in emergency medicine. And that was a great experience. But something bad happened to it. And I lost my mentor, and I lost my funding, and I had to make another choice. So I went to UT Southwestern in Dallas, Texas, and there got some familiarity with operations and innovation and entrepreneurship, which ultimately led to my position at Stanford. So I'm a very literal person. I follow directions like to the T. So when it says, what's your secret sauce? I contrived a recipe for a sauce. I'm from New Orleans originally, and gumbo being one of our quintessential meals. The roux is the most important part of the sauce of the gumbo. This is true, right? And it's very, very hard to make. So from the secret sauce perspective, I think the roux, as I would say, and it takes like hours to make a good roux, is a healthy portion of yes. And Ian mentioned this a little bit. You say yes until you can say no. I like that. That's very nice. And they might not always be things that you necessarily really wanted to do, but it's early in your career. It's justifying that you can take an idea from start to finish, and that you can think of something, and that you can execute, and you can seal the deal at the end. And other people who help find you other opportunities need to see that you're willing to do that, because they need to be able to put that faith in you to be able to move forward. The next ingredient is it's a combo. It's like lemon pepper, self-compassion and gratitude. You know, everyone makes a ton of mistakes, and it's so easy to come to one of these meetings and see all the non-mistakes, all the successes, all the accepted abstracts, the accepted didactics, and everything. But for every one of those, there's actually probably a few attempts that didn't work out so well. And Lynn Richardson was saying yesterday that, you know, people know her for the grants that were successful and not the ones she didn't get. But that's a huge part of getting the ones, or getting to the point to get the ones that you need to get, and getting to the positive ones, and getting to the yes, that there are pieces of this that don't necessarily always work out, and it's okay. It's okay to falter. It's okay to make mistakes. It's okay not to make the right choice, as long as you can pick yourself up after a day or two of mourning and keep on going. I feel as though gratitude, I get a great deal out of recognizing what other people are doing awesomely and telling them about it. It's more for me than it is for them, actually, but I think it's somehow paid off for both sides over time, because it makes me feel really, really good to do that. And maybe occasionally it sparks a collaboration. It sparks somebody else to do something else. And it might be kind of silly or hokey or soft or whatever, but I feel like genuine gratitude for our colleagues, for our work compatriots like nurses and techs, and our residents, goes a long way to furthering your own career as well as everybody else's. I also feel like a teaspoon of admitting when you're wrong, and it's okay to say you're sorry. I was kind of raised under the premise of don't say you're sorry, it's a sign of weakness, and don't put cream in your coffee because that's a sign of weakness. And I followed all these rules and said, okay, don't say sorry, drink your coffee black, do all these things. And I think a sense of, I have genuinely given people the wrong medication that have almost killed them. I have called my faculty member by the wrong name in a faculty meeting. I have made huge mistakes otherwise that I can share from time to time. And it's okay to forgive yourself and say, all right, I made that mistake, and move forward. And I think there's a lot of respect that's gleaned from people who are able to admit their mistakes and admit them quickly. It's one thing to admit a mistake when someone's pointed it out to you. It's another thing to admit a mistake right up front as soon as you make it. And it's remarkable. People just forgive you for that afterwards. If you're able to just say, yes, I made a mistake, that was good, I won't do that again, it's like everybody forgets about it. And even with more serious things, I think that admitting when you're wrong and admitting it quickly is really important. Lastly, I'll say it's kind of the sprinkle on top of the perfect sauce, is genuinely learning what makes you tick and what you love about your job. And that's really harder to do than you think it is, because you say, oh, I like seeing patients, or oh, I like doing research. But on what? What sort of patient? What about it do you like? Do you like the procedure part? Do you like the intervention part? Do you like the mystery, the puzzle piece? That happens to me all the time. And I'm sorry, see, it's so easy. Nonetheless, and to stay to really, and it takes years, I think, and it took years for me to realize that I liked gadgets, I liked technology, I liked making new things, and I would devote the rest of my career to innovation, entrepreneurship, technology, commercialization. But it took me way too long to figure that out. But I should have known it a long time ago. I was putting stuff together in weird ways and MacGyvering myself through different shifts. And to be able to say, okay, I figured it out, but if I'd really listened to myself and perhaps not simply kind of followed a path, I feel like that you know, things could have been even better. But I think really kind of getting down to what part of this really makes you want to do it more, because that makes all the difference in terms of your future career. And a big part of it was I just wanted to make it better. Whether that was as a resident or otherwise, I just wanted to find a problem and fix it. So I get a big joy out of identifying a problem, figuring out a way to fix it, and then fixing it, and then taking no rest or anything, just finding a new problem. But I get a great deal of joy out of that, and that joy has really persisted and helped me persist in my career over time. And then lastly, at some point in your career, whether it's the late phase or the legacy phase, is to realize it's not about you anymore. It's not about me anymore. It's about forwarding the career of the next generation of emergency medicine, because we have a great, great field and we have a lot of work to do, and that's a real way, I think, to help improve the impact of your career moving forward, looking over the entire journey. So thank you so much.
I have one question for you. There's been, you know, many commentaries recently on work-life balance. How did you find work-life balance?
Work-life balance. So I think a lot of people think of this as a scale, a balance, if you will. And to me, over time, I think it's been more of a teeter-totter than to realize that very rarely are both sides going to be equal and kind of be in this equipoise of thing. It's going to be more often than when we were kids, or maybe now adults, you might have a teeter-totter at home. I don't know. I don't want to judge. But nonetheless, you know, when sometimes somebody gets off the teeter-totter prematurely and all of a sudden, chang, it goes out of balance. But most of the time, if you plan and communicate, you can kind of keep them in some sort of thing, or at least going back and forth. So maybe you work really, really hard on a grant for a while and then go on vacation. Or, you know, go through a long, long string of rough several months of clinical shifts and then do something good for yourself or your family. And I've found that it's not as much of a balance, but this sort of ebb and flow over time, this sort of teeter-totter motion that ultimately works, because I think, quite frankly, the notion of a balance is a true balance all the time is not possible. That's just my opinion. But nonetheless, I feel like that's the way that it is most effective.
Thank you. Dr. Kuppermann?
Great. Thanks a lot. It's really lovely to be here. And as always, when you sit on panels like this, you always learn from your good friends and colleagues. I've been jotting notes while Ian and Andra have chatted. So in fact, yesterday, Andra and I were on a little bit of a different panel as for very junior faculty members, and it wasn't exactly about secret sauce. But what I'm going to tell you over the next 10 minutes are, I took Jody's instructions very literally. What are 5 principles that allowed me to succeed in academic medicine. First, I'll say just the overriding principles, and then I'll get to a few of the details in the next 10 minutes. So the overriding principles for me is that as I progress through my career, I have wanted to have a greater and greater impact on the health of acutely ill and injured children. Really, that has been the overriding principle. And as many in the room, you know, I started as a resident, really, you know, very invested in clinical care and doing the best I could with clinical care. And then to broaden my impact after that, I became chief resident, where you teach, and you then teach clinicians how to do better care to their patients. And then I learned early on that if you can discover better ways to care for patients through research, then that's what the teachers learn, who then teach the clinicians, and your impact broadens. So that's been the overarching principles that have gotten me here. But with that as the overall theme, a few specific principles. And the first one, And I know Ian and Andra probably said the word as well, but it is this issue of passion. We are very blessed in academic medicine that we can pursue what we're passionate about. And without passion, it's hard for me to make progress. So I, very early on in my career, and this is how I developed a passion around research. And sorry, Andra, because I told this story yesterday, but I'm going to tell it again today. I was a second-year resident. I was at Harbor UCLA in the middle of a meningococcal epidemic. And there was kids coming in every day in overwhelming with puerperal fulminans, septic shock. And I was a young resident learning how to take care of a lot of sepsis. But I was in the ICU one day when a young child came in, and I had to put in an art line in one of their hands. And I remember that hand was completely clear of any purpura or no signs of early gangrene, nothing like that. And I was also the PICU resident for the month, so I observed the child over the month. And over the course of the month, the child developed necrosis of all three limbs, but the hand with the art line in was completely spared. And I was there when the child presented, so both hands looked identical originally. So I thought, wow, I was a second-year resident. I just didn't get it. I have a big rope in this hand, and this hand is spared, and the other extremity is necrosed. And of course, I thought about it a bit, and it was thinking about it's the heparin that's in the art line. And so I started researching heparin. And I did a really crappy little research study, retrospective, about heparin and puerperal fulminans, but it sort of got me going. And then I spent the next 10 years of my career studying meningococcal disease, predicting which children are going to have good outcomes and bad outcomes, because I want to know who to invest our resources, and then trying to identify children with unsuspected meningococcal disease from the thousands who have fever. So it was all about that passion of something that appeared in front of me that didn't make sense, and I wanted to know better. So passion to understand. The second thing that I will say, and this does go to the principle of breaking down like sort of iconic stuff. I've had a lot of grant success. I've had more grant failure than success. That's just normal. And the only reason that I have been successful with a lot of grants is that I've written a lot of grants and I've worked long hours, but my hit rate is probably not that much different or better than anybody else, but I just have stuck with it. And one of the things that I will say that was very important for me, and I'd really advocate for young faculty members, is that although I'm very aware of the academic process, you need to get publications and you need to do some small stuff to get some publications, early in your career, stop the little stuff. Focus on something really important and meaningful. And you will fall down and you will get dirty and things won't work, but then some things will, and they will really, well, I say they'll move the dial in medicine. Because for me, it's all about trying to move the dial a little bit. And one of the tips I would say is that, and this is what should embolden you, because I fear failure like anybody else, but I realized early on is that when you fail, people really aren't looking and scrutinizing you because they're caught up with themselves. They're worrying about their own career. So they're not like watching you that closely. So you can be big and bold and you might fail, but you get up and dust off and you go on and something then will work. As I think it was Linus Pauling, by the way, I come from a family of scientists. My father was a physical chemist at Caltech for 50 years, and his chair was Linus Pauling, two-time Nobel Prize winner. My father did not have a Nobel Prize, to be really clear about that. He had a little chip on his shoulder about that, but side note. But Linus Pauling, they asked Linus Pauling, how did you have so many great ideas? He said, no, I didn't have that many great ideas. Two-time Nobel Prize winner, right? He just said, I had a lot of ideas, and a lot of them were bad, but some of them were good. So that is sort of my principle on that. And for me, by the way, I've kind of broken the principle of focus. I have 3 lines of research that I'm just obsessed with, and it's all I do. And you guys will probably read. I studied the febrile infant, and that was an offshoot of the meningococcal patient that I cared for way back when. Then I studied the evaluation of the pediatric trauma patient, and it was the same principles that when I came to UC Davis, I had learned the principles of research, and I arrived there, and there's all these children getting CT scan up the wazoo. It just didn't make any sense to me. And I wanted to put some sense around it because I knew, this was 20 years ago, I knew there was some problems with the radiation they must be receiving, and that just didn't feel right. And so that sent me down that line. And the third line of research is around diabetic ketoacidosis in children. And why was that? It's a similar principle. That is, I cared for a patient with, okay, I know Andra's going to make a comment that it sounds really cute. She then became my wife. She's a peds endocrinologist, but we cared for a patient together. She was not my wife then. She was a resident, and I was a fellow, but it was a child who presented with DKA with overwhelming cerebral edema, needed intubation. But we hadn't touched the kid with fluid, and we were always taught, you give fluid. That's what's causing cerebral edema. I said, well, that's weird. We were taught this, but this child looks really bad and is really dry. And that started a 20-year path of investigation because I was just driven by, I needed to know why. And so that's sort of the common theme, and there were some big victories and lots of failures along the way. The next principle that I would say is you need to invest in yourself. And this is putting it in, I'm just kind of putting it in context of what others before me have said. So this is still in the early to mid phase of your career, before that legacy phase. See, Ian, we're kind of copying what you say a little bit here. But yeah, you okay with that? All right. So, so you have to invest in yourself. And so I would say if you were a resident, if you have the inkling, do a fellowship. Get some extra training. And if you're a young faculty member, get whatever extra training. So for me, what that translated to, because I trained before the era of K awards. So what I did is I probably took 4 or 5 grant writing courses. At noontime, I went to like all the noontime sessions, how to give feedback, how to do whatever. Social media, it's not that I'm a big Twitter icon, I'm not, but social media, it's important in my portfolio of disseminating my research, so I took intensive courses in that, and I had the good fortune of taking a few sabbaticals. At UC Davis, it's allowed, and what the importance of the sabbaticals were, it allowed me to invest in myself so that I could continue on this path of trying to impact change. And perhaps the most important sabbatical, I was a sort of assistant to associate professor. I went to London for 6 months to work with an injury epidemiologist who was brilliant, who taught me some new ways to think about it. And I spent 6 months at the UC Davis Business School learning about social network theory, innovation, because I realized to have a really big impact on research, I needed to work in a network, because pediatric adverse outcomes are infrequent enough. You need to pool resources and pool sites, and that's where I came up with the idea of PCARN. But it took me to be away from my immediate environment to kind of think with others outside of my field about how to have a bigger impact. So investing in yourself. And as an aside, I became a chair serendipitously. It was not my goal. My goal was to impact the health of children. But along the way, this becomes sort of into the legacy phase. I was picking up a lot of mentees, and I have a gaggle of mentees, and I really enjoyed that. And sort of mentorship and leadership kind of come part and parcel with what I'm describing, and I became a chair. But it really was and I really have enjoyed that because it's allowed me to, again, broaden impact to faculty, but it wasn't my goal. It was sort of a side light that just happened along the way. And the last 2 things I'll say, keep within my 10 minutes. Collaboration and investing in others. I mean, you have to be good to others. It's not that I do it, I force myself to do it. It's sort of how I was raised, but it goes along with the principle of saying yes when you can, being good to others. You never know when it circles back and helps you. And my 3 most important collaborators in those 3 lines of research I told you about, the febrile infant, I met my most important partner. He's a peds ID doc at Ohio State in Columbus. I happened to be there for a meeting, and he had this technology that he was using to study kids with pneumonia. I had this gaggle of febrile babies that I couldn't figure out what was the best way to diagnose it, and he had this great technology. I had this playing field of PCARN with febrile babies. We got married, and we've been collaborating ever since. So this notion of collaboration, networking, really important. Around DKA, my most important collaborator, okay, it is my wife, what can I say? And that actually works well. She can be moving the science forward, I can be taking care of the kids, and the vice versa. So if you're in that circumstance, sometimes it works out. And in pediatric trauma, when I came to UC Davis, my first mentee was Jim Holmes, who will be presumably president after Ian, but And Jim had the approach of the general emergency physician. I had the approach of the peds emergency physician, and we've been working together for the last 20 years. So that collaboration thing is really important. And that's the last thing I'll end with is this. The notion of networking and collaboration, super important, but you have to think about it carefully because back to the work-life balance and making the best use of your time, every time I go to a meeting, it's time that I'm not writing a paper, I'm not mentoring somebody, and I'm not with I got college-age kids, but I got a tag-along kid because I adopted an orphan baby from Guatemala, and now she's an 11-year-old soccer star, and I want to be with her all the time. And so every time I go to a meeting, I'm aware of the potential to meet people and collaborate, but I'm also conscious of what I'm potentially missing out on, whether it's productivity at work or family stuff. So you have to network, you have to collaborate, but just make best use of the time and decide when it's a good time to do it and when it's a good time to stay home. And those are the, I guess, 5 principles that have led to my success as an academic.
Thank you. I have one question. What do you think was your biggest mistake as a leader, and how did you overcome it?
Yes, so that's a painful question always, and I've made plenty of mistakes. But I would say the biggest mistake, and I haven't overcome it, I deal with it every day, it's the issue of overcommitment. So what happens is when you build important commitments, as everybody here knows, the commitments are sort of long-standing. If I take on a mentee, I'm going to commit to that person because that's just the way we are. And so I slowly developed a lot of commitments, either as a mentor, running a research network, or as a chair of a department. And then before you know it, you're overcommitted. And overcommitment is a really bad thing because then you feel like you're not doing anything really well. And I hate that feeling. I want to be right in that sweet spot where I'm doing enough that it's interesting, but I feel like I'm doing it really well. And sometimes I'm just too far off the edge. So the question is, how do you ratchet back? And it's that I think about it every day. Where am I not needed anymore? Where can I just cut back to keep it fixed? So I haven't come up with a final solution, but I think about it every day.
Great. Thank
Thanks.
you. Dr. Hopgood?
All right, well, Jody's got me back in cleanup, so I think that, let's see, that we can do this. That'll be good. I think there are a lot of great things that you've already heard. You know, I think Ian's comments on kind of the life cycle and Andra's recipe and Nate's themes of collaboration are all really important. The one thing that I heard in all of those comments earlier was about your passion and really finding your passion and then being really pretty clear about that. So for me, I started out not as an emergency physician. In fact, I started at a residency training or at UNC hospitals in family medicine. Emergency medicine wasn't present as a training program at UNC at that time, and then you know, it just didn't really fit with me. I really like super sick patients. I didn't really like to talk to patients again and again and again in an office setting, but I liked a lot of things about it, you know, in terms of cradle to grave and, you know, like the making diagnoses and all those things. And so then when Judy Tintinelli came to UNC then and started our residency training program, that was an opportunity for me to come back after working in a small rural emergency department for 5 years and retrain as an emergency physician. And I was absolutely passionate about emergency medicine as a discipline, as a public health service, as a means of accessing health care, and really, honestly, as a way of training students. And so I really wanted to give to students the thing that I didn't have, which was a great educational experience in emergency medicine. So that really started my career trajectory as an educator and propelled me along a path as both first the clerkship director in emergency medicine, and then as the electives director for the School of Medicine, and then as the curriculum dean for the School of Medicine, and then as the dean for educational development across all the school. And so that really was, it really pushed me in that direction. And it wasn't something, again, that I like said, oh, I'm going to go do this thing. I'm going to get this title or acquire this or do this work. It was organic, but it was all driven by passion. So there's something else that I think that that I do that that I've observed that some folks do well and some don't. I read a lot and probably would have had better grades in medical school if I hadn't read all of Sherlock Holmes, books. Arthur Conan Doyle, was kind of my second year secret. Kind of thing that happened, like late night I get, to read Arthur Conan Doyle. And, Sherlock Holmes once famously said to Watson, "Watson, you see, but you do not observe. The distinction is clear." And we are the most highly trained observers in medicine, but we don't necessarily apply that skill, I think, uniformly across all the things that we see. And so it's really important to me, and I do this a lot, to think about that, because I use that to develop judgment. Because ultimately, at the end of the day, what you really want to be if you're a master of anything is you want to have great judgment. And so we try to train our trainees to do that in the clinical environment, but we leave it there and we don't lift that up and say, you really should be observing this in all aspects of your life. And so I use the scientific method. I mean, I'm pretty deliberate about it intellectually. I don't usually tell people this. I see a couple of my faculty members out here now that are going to know all my secrets, is that I observe something that happens. I see this thing that happens. Nate and I were talking about the dean's office and things that happen in the dean's office, and look at that. That's an interesting thing. Look at that. Wonder what the outcome of that's going to be. And then I'll place a small internal wager on what I think the outcome of that activity is going to be. And then, and then I observe. So I'm generating a hypothesis. I have, an endpoint in mind, and then I observe. And so I really do think that that helps you develop, your judgment and, sometimes your emotional intelligence, and really helps you understand people and outcomes, and honestly helps you not step in it so much sometimes. When you've seen that happen 2 or 3 times, you might want to choose a different path. So the other thing that I think that I've heard as a kind of enduring theme across all of our presenters is this concept of resilience. Success is not necessarily a given, but hey, and like the things I tell my kids, and and a lot of times my faculty is, hey, you can't win if you don't play, right? So you got to put it out there, and everybody who puts it out there fails a lot. But you also succeed, and you often succeed in places that you didn't necessarily anticipate. But when you do fail, I think it's also really important, again, to take that step backwards and kind of, if you've ever read the work of Schoen, the reflective practitioner, learn from your mistakes and be introspective about what worked here and what didn't work, and be thoughtful about what you'd do differently, again, if you had a second chance. When you get peer review, that's a great opportunity for folks to give you some insight into that. But oftentimes when you're in leadership roles, or you're trying to you're just trying to convince people to do what you want them to do, you need to be, and it doesn't work, then think about what happened and where you went off the rails with that, and you can learn a lot about how to lead and how to achieve success. The other thing I think is it's really important for you to know yourself. You really need to know what your values are. What do you really care about? We talked a little bit about passion, but there's a whole set of values that each of us carries that are internalized within us, and you really need to understand that about yourself. What are the things that you're willing to do, and what are the things you're not willing to do? And you need to honor that, because you will never really be happy if you don't be true to yourself. So my next thing would be to honor your own happiness. Sometimes, you think you want to do this thing, and it sounds great, and you got a big title, or you're doing X, Y, or Z, and it sucks. You're like, this is bad. I really do not like this at all. I am not enjoying myself. I go home at the end of the day. I'm not, I'm just like, buh. That's that. Like, you got to be able to read that about yourself and be true to that. And if you're not happy, if you're not finding, happiness in your role or position or your relationship, you got to figure out what are you going to do next, and be willing to make that change. That sometimes takes a lot of courage, to step away from something that everybody's like, you're going to do what? You're going to do what? And I'm like, yep, I'm not going to do this anymore. But don't just stop, be true to your commitment, honor your commitment, do your work to the end of your term, do what, you said you would do, but then work on figuring out a succession plan or figuring out how you can leave the place or whatever situation better than you found it. But you don't have to stay to do it if it's just a slog for you. Go find your joy and do it, because that statement of, you never work a day in your life if you love what you do, it's really true. And so that, I think, is a really great truth. The other thing I would say is believe in yourself. You got to take some risk to succeed, but if you don't, believe in yourself, you can't really be thoughtful about taking those risks. I mean, I'm not telling you to go out here and just, have risk-taking behavior, like buy a bunch of guns or jump off a cliff or whatever. Be thoughtful about what you're doing, and calculate that risk internally and say to yourself, I think I can do this. And then, if somebody asks you to do something, they're asking you to do it for the most part, like take a leadership role or something that you might not have conceived of yourself. They're asking you to do it because they think you can do it. And if it fits with your values and it fits with your passion, then that's something that you should consider. And you can have some dialogue around that task or that challenge that you're being asked to, to either to lead or to take on, and make sure there's real clarity around that. But, again, I want you to think about that, because if somebody's asking you to do something, even if you think that you're not ready, and I see this a lot in women, that women are like, oh no, I got to do this, and I got to do more of this, and I got to have more of that. If somebody's asking you to do something, they think you're ready. Have a thoughtful and engaged conversation with that person and be willing to take some risk. And that kind of, those things that I just said about knowing your values and knowing your passion really should lead you to a place where you have internalized personal either vision statement or mission statement for yourself. Carrie Chisholm, who is the past president of the society and the program director at Indiana, I was really pleased when I came to IU to hear that all the residents, were writing their own personal mission and vision statement. And that's something that I did many, many years ago. And I believe that it's actually been really important for me to have a sense of who I am as a person and a vision for what I want to accomplish along all those different phases of my life. And then be resolute. Sometimes you face some things that are going to be difficult, and you may be the only one that believes that this path is the right path to go. But if you believe in that path and you think it's the right thing to do, and you search your soul and you think that it is worthy of your commitment, then commit and be resolute and move forward along that path. So I think, I guess all of that just says is be courageous and live your life with joy and affirmation. And you'll get a lot of really great things done, and hopefully you'll have a lot of fun doing it. So that's it.
Thank you. One question, what was your biggest challenge in your academic career, and how did you overcome it?
So I would say there are two pretty big tiers of challenges. The first was having a family. So, I've got, a couple of kids, and and a Southern mother who expected them always to be, perfectly dressed, spit shined, my house to be, perfect. And I was facing, mounds of laundry, papers that were unwritten, all of that stuff. So, trying to figure all that out and figure out what things I could let go of and what things I really needed to, attend to, was a challenge for me. And kind of like Nate, my eyes are probably bigger than my stomach, and sometimes I overcommit, and that leaves you in a difficult place. But I'd say the one thing, though, from an, like a leadership perspective that's most important is learning how not to be an emergency physician as a leader. And when I say that, what I mean is emergency physicians decide things. We decide things quickly, and we give orders. And, that doesn't work so well in the dean's office. That doesn't work so well when you're trying to get another whole tier of other people who are your peers to, to move in a particular direction. And so, really kind of backing off that doesn't mean you can't decide. But you can't tell them that you've already decided. So you kind of have to back off that a little bit and, move that slower and work it along. And, and then don't forget to send the email that you wrote 2 days before because you already decided.
Thank you. to. We're going to open it up for questions. So if you just raise your hand, I will bring the mic around to you.
First, thank you all. I feel very fortunate to have been known and trained by many of you on the panel. I think I'm somewhere in the laser phase right now, and wanted to ask you all the role of having time to reflect, like to kind of figure things out, whether it's your general principle or your passions. Like, was that important to you, and something that you advise maybe your junior faculty, like make sure you have time to think and sort things out?
I think that's absolutely critical. I was so envious when I heard Nate say that, sabbatical. I was like, wow, sabbatical would be awesome. So I have a special place that I go to. It is called the beach. And when you go to the beach, you are not allowed to do, anything, at least for a couple of days, until you have, walked it all off, right? You just walk on the beach, and that clearing of your head actually allows you to think, to be away from things. And if you don't do it, you get deep in the morass, I think, and you make not good decisions.
If I could add to that, so just to be clear, I've taken like 2 sabbaticals in my life, so they've been great, but the reality is that, but the reality is, and I totally agree with Cherri, you sort of have to build the sabbatical into like every day of your life a little bit. And the way I do it, and this is just one tip, and everyone has their time management skills and tips for you, but the way it works for me is that if I have less than half an hour of time, I kill emails, I tweet, I do whatever I need to do electronically, but that's it. Only if I have less than 30 minutes. If I have more than 30 minutes, that's when I use to reflect, to think, or to write, or do the other big things. So little time, little task, which is electronic. Big time I use as thinking time, because that is our most precious commodity in my mind, time to reflect and think. So really important question. But I would say for the non-sabbaticalists, which is most of us, just build a little piece of that sabbatical into each day that you work.
I would just add to that, Dave. I think this is something I've only really learned the importance of probably in the last few years of my career. And I think there's probably been something about being a chair that has really required that. And, when you're a leader and you're at the top of the pyramid, a lot of what you're to do is to set a vision and a set of strategies. And you're really the only person on the ship who can do that. And if you don't create that space, if you're down in the weeds doing the jobs of other people that are on your team, well, first of all, you need to probably look at your team, but you're likely to run aground because you're the only person sort of looking out on the horizon of what's coming, where are we going, what should we be doing. So I'm pretty religious about it now. One thing that I do is in my day, and it drives my assistant crazy because I force her to create spaces in my day so that I can process and reflect. I try to block off one day each week during the weekdays for that. Now I only have about a 20% success rate of actually honoring, but that's 20% more than I've done for most of my career.
Other questions? Yes.
Thank you so much. I think my question almost is similar to that other one, but a little bit different. Do you feel like there's a sweet spot for your career as a leader? Do you feel that like 10 years is where you hit something where it's time to change gears or change pathways, or is it indefinite, or is it when you feel like you're not making a difference anymore? Because I know people have talked about like a 10-year term, but that seems short to me, but I don't know. I'm just curious what your thoughts are.
I'm going into my 4th year as a chair. Someone told me once that if I stay more than 10 years, I'm probably not doing my department any good, because there is some value in the turnover, because it usually means an influx or infusion of new resources that comes with the new chair. So, when I think about my time, I really don't think about it in terms of I'm trying to do X number of years. I just know what I want to accomplish. And that might take 5 years, and that might take 15 years. And so that's how I approach it. And I think once I'm at the point where I've realized all my good ideas and the things I wanted to do for my department, then I'll know it's time to move on to something else.
So I look at this two ways. First of all, actually, the root of the term tenure is actually 10 years. It really is. And there's a lot of institutions, both in the United States, who you have 10-year terms, and in Canada, basically, I think all the chairs have 10-year terms. Having said that, I actually think that this becomes, it's sort of organic. I know when I'm not passionate and I'm not delivering and I'm not following Cherri's principles and I'm not really looking forward to going in, then I know it's time to look for something a bit different and make room for others. And I will say that I am super conscious as a leader of not outlasting my welcome. And I have a pact. I have a lot of friends who are faculty members. I'm a pretty good EQ person, so I have a good internal clock. But I got a lot of spies out there amongst my faculty who I've told them, you have to tell me, I need feedback like others do. So I monitor that really pretty religiously.
Yeah, I think, honestly, it just depends. It's institution specific, I think, and individual specific. If you're a good fit for your institution, you're still able to make it rain for your department. You're still able to, you're running a good operation. People are moving. You're happy. Things are, you're making progress. You have goals still yet to achieve. You can still see a horizon. Then it's okay to keep doing it. The thing that I think often happens is that sometimes people who are really good leaders come in and get swiped, and so that is, so moving too fast I think is also a little bit of a problem. Sometimes that can often destabilize your department. But if you're passionate about what you're doing and you're loving it and it's working, then it's okay to stick around. But, if it's not, then it's time to go.
Thank you. Other questions? I have yes, please.
Your colleague from Stanford made the point of having switched to almost basic research at a certain point. And you talked about taking time for yourself. At a certain point, there are so many new and different skills that don't necessarily belong to our clinical upbringing. Yeah. All of the statistics and the experimental design and assessment of the literature and the things that one would have to do to become a mentor or of any help at all in a department that's trying to develop a research and academic skill. As somebody who's probably more of legacy age, but still at earlier in the career, how would you suggest developing the kind of chops that an academic department needs?
So let me just take a crack at that, and then I'm sure Ian and Cherri have some good insight. So first of all, it is impossible to keep up with everything. I mean, that is something that we all stress about. I'm currently reading a book with others, Brene Brown's Dare to Lead, and one thing, though, one commodity that is really important, that is sort of everlasting, despite artificial intelligence and robotics and whatnot, is the EQ to lead, right? So that's important, and as a good leader, you surround yourself with people who are, the vice chair of research who is on top of the latest research methodologies, and same with your educational director and whatnot. So my sort of general principle is that I do need to stay in touch with sort of novelties as they emerge, but what I really need to stay on top of is my ability to have vision and lead and be surrounded by the right people who are making sure that, and my vision of this in a kind of more sort of a clear sense is that you want a quadruple threat department. In my era, my mentor is an outstanding person, but he expected everybody to be a quadruple threat individual, right? A great researcher, great clinician, great teacher, great administrator. doesn't exist. It just doesn't. It's a fallacy. And if it did, they have a miserable family life. I mean, you just can't do it. It's not real. So my vision as a leader is having a quadruple threat department, but it's made up of a bunch of dual threat people. The great clinician educator, the great administrator, researcher, whatever it is, they're all at the top of their game in their niche, and that allows the department to stay up. And you as the leader just need to maintain the vision and harness the power of all these people around you.
I have nothing to add to that. You nailed it.
Yeah, I agree. It's a team sport.
Yeah.
Other questions? I have an additional question. As the focus shifts to work-life balance in academic emergency medicine, at times it can seem that there's a generational gap in the approach about how you can achieve that. And I'm just wondering, what strategies have you found to be effective when you've been talking with younger faculty, or when younger faculty are approaching you about how they can achieve work-life balance?
So my faculty who are in the audience, I think Dr. Farkas over there, maybe the last left. I actually use a little bit different analogy than even Andra does. So yeah, right. So I think we always think about work-life balance at this very macro level, and she uses the seesaw to sort of describe that. But I think that's just a total fallacy. So let me just put that on the table. What I tell folks is I think of it as a juggling routine, rather. So I don't juggle, but I know there are more pins that you have in the air that you're having to manage than you have hands. So the key for me is to look at it at a micro level, where if I have 5 pins in the air that I'm juggling, 4 of them are probably made of plastic, or let's say it a different way, just aren't that important, aren't critical for that day, but there's probably one that's glass. And what happens when you drop glass? It shatters. And so what I've done in my own life is say, today, what is the 1 or 2 glass pins that I cannot drop? And as Andra said, sometimes it's going to be your family, but sometimes it's going to be a grant. And so that's what I share with my faculty to help them sort of navigate this all-elusive, perfect work-life balance.
Yeah, I already told you about, my mother's expectations and my pile of laundry. It's like, yeah. So I don't think there is such a thing as work-life balance, and I say that and people are appalled. Again, I think you have to be deliberate and thoughtful about what you're doing and choose your daily work to achieve the best possible success for yourself. I think you have to be smart about your scheduling. And try as best you can not to overcommit. And again, if you got your values in line, my children may not have been the most perfectly dressed little beings in the world, but they were always clean and they were always well fed. And so it's one of those things where you just learn to go to the Costco every quarter and fill up the garage, and then you just work it and do the best you can and try to let some of those things that, as Ian said, those things that are plastic pins, let them go. They can just go off to the side because they're not as important either that particular day or honestly maybe ever. But you have to grapple with that reality and find that place in yourself. And I can't choose that for a junior faculty member any more than I could choose it for myself. It's one of those internal struggles that you just have to work through. But if you say, I value being healthy, I value being fit, I value spending time with my partner, I value spending time with my children, if those are your values, then you have to live true to that. And when you find yourself in a situation, like I said earlier, like this is not working out for me, it's because those values are being crossed, and then you're out of balance, and that's your signal that you got to rebalance, and you have to have the courage to just do it. That's the way it works.
I just have a few kind of specifics on this because it's a really important question. So first of all, perfection is really bad. It just leads to anxiety, depression. Don't aim, for perfection. That's something that I had to deal with early on in my career, feeling like, oh God, if I'm not perfect, how will people view me? Well, I've lost all of that because it's an elusive and it's a bad goal. And so, as one of my colleagues, she's brilliant. She's a psychiatrist who spends, of course, in our emergency departments, my tightest partners are the trauma team and the psychiatric team, right? That's who we work with. And she's just brilliant. Her name's Amy Barnhorst, and she wrote an article. She's written in the New York Times, but she's also involved a lot with gun violence and whatnot. But she wrote this article about just choose what to suck at, because you just cannot thrive on everything. But everybody really wants. Right, exactly. Suck at the things that you just don't care about that much. But a few things, because everybody wants work-life balance. I want work-life balance, just like the junior faculty member does. So I just have some very quick, specific things that we've done in the department to make that happen. First of all, I'm very mindful of junior faculty. They got young families and whatnot. I try to cut them a break. I mean, Andra had made a point yesterday, which is true. Ideally, it's easier to cut a break when someone has shown that they've done some early investing, but I will cut hours for early faculty, and we also have a strict night policy. No one over 55 works nights. They tend to work more weekends, so that's important. And we also have a night crew who wants to work nights. And our policy, they work 20% less shifts for the same salary, and they pick the shifts that they work. And what it does, it's what they want to do because it works in their life, and the rest of the faculty only has one night. So there's ways of incentivizing stuff that kind of helps everyone at their different stages and ages. And that, I think it's a really important responsibility of leaders of a department to be very mindful of that at all ages of life.
Great, thank you. We're going to have the masters come down into the audience so you can ask personal questions now, but let's give them a round of applause for their excellent help.